Hello everyone, this is Professor DePaulo. Welcome you back to Psych 265, Research in Psychology. Today we're going to be talking about the results of the discussion and how you're going to use the results to write up your discussion section. So if you go to the Assignments tab in Blackboard, you'll see all the different parts of the manuscript that I've posted here. And what we want to do is we want to open up this how to write the discussion section of an APA manuscript. And as you can see, I want 4 paragraphs. You're going to write the word discussion. You're going to center it, non-bold, non-italics. In paragraph 1, restate your hypotheses. State whether you supported or failed support your hypotheses. And then state the results in words, not in statistical terms. So the results section itself, which I have written for you, and all you have to do for the results section is copy and paste it, what I've written for you, into the final paper, right? The final revised paper. The results section basically gives you the statistics, okay? The discussion section summarizes that results section in a non-statistical language. So what do the results mean in a non-statistical terminology? So let's go look at our results. So I've posted results, and all you have to do, this is a Microsoft Word doc, you just need to copy and paste this section into your final revised paper. You do not have to write anything for results. All you have to do is copy and paste into your final paper right after method. So you're going to have, the title, the abstract, the introduction, the method, and then your results. And then after results, you're going to have discussion and then your references. So it goes right after the method section. Just copy and paste it. It's very simple. Let's look what we found in our study. So the study was based on the survey that looked at COVID and behaviors related to COVID. So here are our results. There is no significant relationship between empathy and mask wearing, and this was the correlation. It was not significant. We expected it to be a positive relationship. So these are based off of the 5 hypotheses that were in the introduction, that were supposed to be in the last paragraph of your introduction. If you don't know what they were, you can go to introduction instructions here, and then you can look it up. These are the 5 hypotheses that we were testing. And these 5 hypotheses should be the last paragraph of your introduction, just written like they are here, in a paragraph form. So empathy will be positive correlated with mask wearing. So what happened with that? Let's see. Let's go back to the results. There was no significant relationship between empathy and mask wearing, so that was not supported. And here's the data. The p-value is 0.121. It should be less than 0.05. For it to be significant, it's not. Okay, so there was no relationship between empathy and mask wearing. We expected a positive correlation. That means that if you had more empathy, you should wear a mask more. We did not find that. We found nothing. We basically found a 0 correlation. Let's look at the second hypothesis. People receiving the COVID-19 vaccine will be more empathic than those not receiving the vaccine. So we wanted to see that people that got the vaccine should have higher levels of empathy than those that did not get the vaccine. So what did we find? Let's go back to our results. There was no significant difference in empathy between people who have been vaccinated and those that have not been vaccinated. This was a t-test. And the p-value is 0.973. That's much greater than 0.05. So therefore, we fail to reject the null hypothesis. So we say there's no difference. There was no difference in empathy for those that got vaccinated and those that did not get vaccinated. And there's reasons why we found, there's a couple of reasons why we're finding no results here, and I'm going to discuss them shortly. So let's go back to the hypotheses again. Health anxiety will be positively correlated with fear of future pandemics. And that would make sense because if you're worried about your health, you're going to be worried about something that's going to happen in the future. And we actually did support this hypothesis. This was the only hypothesis that we actually supported. There was a significant correlation, positive correlation, between health anxiety and fear of future pandemics. The correlation R, which is the Pearson correlation, Pearson product moment correlation, is 0.523, and that's a pretty decent correlation. It's moderate, but on the stronger end of moderate. And the p-value is less than 0.05, so it's significant. So if you have higher health anxiety, you tend to be more afraid of what's going to happen in the future in terms of pandemics. So that's a good thing. We supported that hypothesis. Let's go back to look at the other hypotheses. People that have lost friends and family members to COVID-19 will have higher levels of depression and generalized anxiety. So what do we find there? We find that there was no difference in depression in people who have lost family and friends to COVID-19. P is 0.581. And there was also no significant change in generalized anxiety in people who have lost family and friends to COVID-19. P is 0.449. So there was no effect in terms of if you knew someone that died, family or friend that died of COVID, there was no change in terms of depression and generalized anxiety. And let's look at the last hypothesis. Attachment anxiety will be positively correlated with desire for family and friends to be vaccinated. So if you're worried about if you tend to be more clingy and you cling to your relationships, you're going to be more worried about your family and friends getting vaccinated because you want them around. You don't want them to get sick. And you definitely don't want them to die. Let's see what we found. And we found no correlation there. No correlation between attachment anxiety and desire to see family and friends vaccinated. It's actually negative here, but it's not significant, which basically means it's not different than zero. So those are disappointing results because we had 5 hypotheses and we only supported one of the 5. And that was the health anxiety correlation with fear of future pandemics. Now, some of the reasons why we didn't support our hypotheses, and the biggest reason is we have a very small sample. So our sample is only 19 people. That's really, really small. Ideally, you would want over 100, multiple hundreds if you can get them. But 19 is just really, really small, and that's because the class size is small for research in psychology, and there were a few people that did not complete the survey for whatever reason. And it's really hard to harass people to complete the survey. You ask people to complete the survey, and they're supposed to do it, but they don't all do it. So 19 is small. And if we had a bigger sample size, we may have had more statistical power and we'd be better able to reject the null hypothesis and find results. And we couldn't do that here with 19 people. So that's the biggest problem, is the small sample size. Another problem with this kind of study that we're running is that a lot of people have already gotten vaccinated. So the vaccination rate is up 70%, 75%. In New York City, it's probably even higher. And there's even talks of a vaccine mandate in New York City. So the number of people that got vaccinated that participated in the study was very high. So out of the 19 people that answered the survey, 16 of them were vaccinated. So it was 16-3 in terms of the comparison of vaccinated to non-vaccinated. And as a result, we don't have much in the way of variability here. Because if only 3 people have not been vaccinated in the sample, that's not a lot. That's not enough information to really determine, where these people stand in terms of empathy and in terms of anxiety and depression and all that stuff. So ideally, I would have liked to have a greater variety and had many more people that were not vaccinated. But the problem is that in New York City, a lot of people are vaccinated, and we have a small sample size. And one of the requirements for attending BMCC, actually in person, is to be vaccinated. So our sample is going to be tending that way, towards being mostly vaccinated. So in the future, if I were to run studies to try to publish them, I would want more unvaccinated people. I'd want a bigger sample size, yes, and I'd want more unvaccinated people. So those are difficult issues to deal with. When you only have 3 people that were not vaccinated, that's just not enough. And that's why you're seeing a lot of these poor results here. You're not supporting these hypotheses because of the low power and the really unequal 16:3 sample size difference between vaxxed and non-vaxxed. Some other things is that it's an online survey, so you don't know if people are giving you the accurate information or giving you information that makes them look good. So that's called social desirability. They tell you basically what they think you want to hear. And so maybe, people think that took the survey think that they should respond in a particular manner, that they are high in empathy, and that, they're low in depression, and they can alter their responses in that way. It kind of affects the validity of the survey. Now, I'm not saying that happened here, but I'm saying that's a possibility. Is it's always possible to, you determine that the survey is asking about depression, you maybe will alter your response to make you look less depressed. Even though the survey is anonymous, people will still do this. They don't want to tell you that they're depressed. They don't want you to know this, even though there's no way I can know who's responding in this manner. So there's that possibility, although that's a weaker possibility, because I think people in general respond accurately to surveys. There's always a possibility that a couple people may not. And when your sample size is 19 and a couple of people may be fudging their answers a bit, that can really affect your results. That's once again a reason why you need a big sample, which is the biggest flaw in the study. So let's go look at the discussion again. And what do we have to do here for the discussion? So restate your hypothesis. Well, you have your hypothesis from the last paragraph of the introduction, right? Those are your hypotheses. So what you want to do is state whether these hypotheses supported or failed to support. What were your results? Did you support your hypothesis or did you fail to support your hypothesis? And 4 out of 5 occasions, we failed to support our hypothesis. So you want to say there was no difference in empathy, or there was no correlation between. Actually, a better way to say this would be we failed to support the hypotheses that there was a positive correlation between mask wearing and empathy. That's how you would state it. That would be the first one. We failed to support the hypothesis that there would be a positive correlation between mask wearing and empathy, and then continue that throughout. And you don't have to use the word we, because I'm not a big fan of using the word we, but you can say there was no positive correlation between mask wearing and empathy. There was no relationship between vaccination and depression. So you can just write it out like that. There was a positive correlation between uh, attachment anxiety and fear of future pandemics. So basically, that's 5 sentences corresponding to your 5 hypotheses. And you only supported one of them. So that's paragraph 1. You're just kind of summarizing the results without the statistics. Paragraph 2, how do your findings relate to past research? So based on your research, did you get different results here? So maybe you saw in the research that you conducted that there was a relationship between empathy and mask wearing. And in this study, you did not find it. Our class study, we did not find this relationship. Why or why not? So you would want to talk about there was a difference. So and so, these two, the authors that wrote the paper that you researched, maybe you have that in your introduction. So and so found a relationship between empathy and mask wearing. In the current study, this relationship was not found due to X, Y, and Z. So you just want to talk about Are your results from this study similar or different from the results of previous research? You don't need to talk about why here. You just need to state whether you have similar or different results than previous research that you should have had discussed in your introduction. So, empathy and mask wearing, similar or different than what other people have found? Probably different, right? Vaccine and depression, vaccine and anxiety, similar or different than what other people found. And just state that here in paragraph 2. Now, in paragraph 3, if you fail to support your hypotheses, please explain why. So here's where you're going to really do the breakdown of why you failed to support 4 out of 5 hypotheses. And those reasons why are the limitations of the study. And I had mentioned them just previously. Limitations of the study include low sample size, right? 19 people, not enough people. The other limitations could be that the sample was primarily from New York City, because the vast majority of people in the study are coming from New York City. And maybe New York City thinks differently about vaccinations and mask wearing than, say, people in Alabama, Arkansas, middle of the country, Kansas. I don't know. I mean, there were high rates in the southern parts of the United States in terms of COVID. There were much higher rates and there were much lower vaccination rates in, say, Alabama and Arkansas. And why is that the case? Is it due to the governor of the state not, enforcing mandates or not requiring things? Is it due to the people that live there? Is it due to their political ideology? So if they're more conservative, if they're more supporting in terms of supporting Trump, are they less likely to vaccinate? I don't know. This is not like a political analysis here, but there are real differences. There are much higher vaccination rates in the Northeast compared to the South and parts of the Midwest of this country. And why is that the case? So you could talk about that here. That could be a limitation, that our sample was from New York and there's a difference in sort of opinions and politics and stances on vaccination. And if you're going to talk about it, go find research that supports it. Go find research that supports this idea that people in Alabama, Arkansas, etc., are not being vaccinated. And why are they not being vaccinated? Go find that research. It's out there. I don't know off the top of my head. I know that the vaccination rates are lower, but I'm not sure off the top of my head exactly why. So that's another limitation. Where the sample comes from, the small sample size. Think of any other problems with the study. You can think of, like I said before, social desirability. People may respond in a way that makes them look good. That could be a limitation. Maybe we weren't asking the right questions in the study, or we asked the questions awkwardly. I don't know. What were the other problems in the study? Another big one is the vaccination difference. The 16 out of 19 people were vaccinated, so we didn't really get a really good measure of how people that are unvaccinated feel about various issues, because there were only 3 of those people. And this is not a like vaccine is good, non-vaccine is bad. This is not that kind of issue, because people can make their own decisions about, do you feel comfortable getting vaccinated or not? And if people are not comfortable, that's their decision. At least that's sort of how I view things. This idea that people make their own decisions and they live with the consequences of their decisions. And I know plenty of people that have died from COVID. And I also know people that had access to the vaccine, refused to take the vaccine, and then died. And it's very frustrating to me to see that happen. older people too that just did not want the vaccine, and then they got sick, they were in the hospital, they died. And I was very upset, and it was very disturbing, and I wish they would have taken the vaccine, and they didn't. But that was their choice. They chose not to take the vaccine, and you have to live with that or deal with it. Even if it means someone dies, you could try to convince the person this is probably for your best interest. You're older, you're more at risk, but in the end, if someone chooses not to make that decision, that's their decision. So all of that plays a role in terms of, you know, how does empathy relate to vaccination? Are you worried about yourself? Are you worried about, getting other people sick, getting a loved one sick? Have you seen people get sick? Have you seen people die? That's going to affect your response in terms of vaccination, in terms of mask wearing, in terms of social distancing. And I'm not here to judge anybody and say anything's right or wrong. I'm here just to try to find out why. What makes someone more likely to get vaccinated, more likely to wear a mask versus not. And if you need to target the demographic of people that are not being vaccinated, how do you reach those people? Can you convince them? Is it worth trying to convince this population, or is it worth just saying they've made their decision and they have to live with it, for good or bad? And that's what public health experts in this country are struggling with right now is, people are dying. Is there any way to stop this? And there may not be a way. Maybe you've reached the point where you have 70% of the country vaccinated and that's it. And there's nothing you can do to convince those 30% of the population that they need to be vaccinated. But your federal and state elected officials don't want people dying because it makes them look bad. And they want to be elected, and so they want to lower this death rate. And obviously, for the good of the country, you don't want people to die. Even if they choose to not be vaccinated, they're willing to risk their lives. You still don't want people to die from this. So it's a difficult question. It's something that we're not going to be able to answer, obviously not with a pilot study of 19 people, but it's still one link in the chain that you can run other studies off of, more involved studies. So that's just an issue. And, we're trying to figure out, you know, can this survey tell us something, or is the survey not telling us important information? So those are some of the various limitations of the study. You could talk about them in paragraph 3. And then external or internal validity. Internal validity is cause and effect. Can you draw cause and effect conclusions based on the survey? The answer is no. The survey does not have internal validity because it's not an experiment. You would need a true experiment with random assignment to draw cause and effect conclusions. We don't have that here. We have a survey. So we can't draw cause and effect conclusions based on anything. So internal validity doesn't exist with survey. External validity is generalizability. So how well do these results generalize to the population at large? Well, there are 19 students participating from New York City, or pretty much almost everybody from New York City. Maybe there's a couple people not. Does that generalize to everybody else out there? Does it generalize to all New Yorkers? I don't know. Does it generalize to everybody in the country or everybody in the world? Probably not, right? Are New York students at BMCC or students in the research class in psychology different from the general population? Maybe, maybe not. The issue here with external validity is that we only have 19 participants. So with 19 as your sample size, it's kind of hard to say that these 19 people represent the entire population of all people thinking about getting vaccinated in this country. That would be really, really phenomenal if these 19 people represented that, but that's not the case because these 19 people are mostly young adults, mostly female, from the New York City area. And the population is much more diverse than the sample would entail. So you can draw your conclusions about whether this study has external validity. You should be talking about that too in paragraph 3. And finally, in paragraph 4, what are the real world implications of the results? And that's what I've been talking about for the last 10 minutes. Vaccination. How do you get people vaccinated? Can you get everybody vaccinated? Is it even possible? Does empathy play a role in vaccination? Does vaccination play a role in terms of depression, anxiety? Does knowing somebody that got sick and died play a role in how you feel about all this stuff? For me, it does. I know people that died at the very beginning of the pandemic. My uncle died in March of 2020, and he was working selling medical equipment because that's his business, and he would visit all the hospitals in New York City, and he was at all the hospitals, and that's how he got COVID. And he was one of the first people that got COVID. He was sick for several weeks in March. No one knew exactly what it was until it was COVID. He didn't get better. Then he was put on a ventilator, then he died. And no one can go to the hospital to see him because he was quarantined. And it was terrible. So, then I knew a bunch of other people that died too, family and friends. People's mothers, fathers, brothers, sisters, in some cases, children. These have all real world implications. How do we stop this? How do we maximize the protective forces that we have, or the protective steps we can take, measures? How do we minimize the spread of the virus, minimize death? All of this is at the heart of a simple survey that I put together. Obviously, it's not everything. It's not the answer to everything. It's not. It's far from that. But it is related, and it does tell us something. Obviously, we'd want more than 19 participants, but it still tells us something. It tells us about health anxiety and pandemic. So if you tend to be very worried about your health, you're going to also be worried about the next big thing happening. And how is that going to affect your behavior? Is that healthy for you to be worried about the unknown? It's a lot of anxiety involved here. Are you going to be super paranoid about what's to happen in the future? Is there going to be another pandemic? Is there going to be another variant? No one seems to know. Probably. Are we going to handle the next pandemic better? Or are we going to is it going to be like SARS or MERS, where you had some people die, but not many, and it was localized? Is it going to be like COVID again? Is it going to be worse than COVID? Imagine something where the death rate, fatality rate, mortality rate, whatever you want to call it, is higher than 1%. Right now, the mortality rate of COVID is like 1%. What if you had a disease with a mortality rate of 10% and it was contagious? How do we handle that? Can we learn something based off of what we just went through? I don't know. No one seems to know. No one seems to even know how it started. We have different ideas, but no one will commit to saying, is it a lab issue? Is it a natural spillover effect? And it's become politicized, which is disastrous, right? This is not about China versus the US in the search for an answer, but that's what it's become. And I don't know if there's any way to stop that or to break that down, because we really need to know what's happening to prevent something happening in the future. And unfortunately, we're not going to know because there's just too much political angst and ill will towards each other at this point. So there's a lot of real world implications. Talk about them. You don't have to go on and on like I've talked about it, but just give me, a couple sentences. at least about the implications of the study, involving empathy, involving mask wearing, vaccination, anxiety, all that stuff, all the things we measure. How would you address the limitations of the study? So if you were to do future research, and how would you fix the problems in this current study? Well, that's pretty easy. There's a lot of problems to fix. The easiest one to fix is the small sample. That's probably the most important one to fix. Can you fix the small sample? Yes, you can. It's very easy to do that. So talk about how you would fix the problems in the current study for future studies. And so that's it. It's a four solid paragraphs. Four solid paragraphs, thoughtful paragraphs, organized paragraphs. Paragraph one, just talk about whether you supported or failed each hypothesis. Failed to support each hypothesis. So we only supported one out of five. So just state the hypotheses and talk about if you supported them or failed to support them. Paragraph two, how do your findings relate to past research? So some of the stuff you looked in terms of the introduction, that you included in introduction, how do our current results fit with past results? Were they similar or different? Just talk about how they were similar and how they were different. And I'm sure our results are going to be different from a lot of previous studies because of the sample size issue. Or maybe the sample, the quality of the sample, or does the sample represent the general population? 19 people, it's a big problem. But if our results are different, if other studies showed empathy and vaccination to be related, talk about it. Tell me that. And cite the studies. So Jones and Anderson, 2020, found that empathy increased in those people willing to take vaccinations. So cite the research that disagrees or agrees with us. Cite it. Give the author and the date of the study. So you should be using citations in paragraph 2. Paragraph 3, if you fail to support your hypothesis, explain why. Lots of reasons why. I went through them all. Talk about them. These are also the limitations of the study. So the reasons why you failed to support your hypotheses are the limitations. And there are a lot of limitations of the study. Are there problems with internal or external validity? Internal validity is cause and effect. Obviously, with a survey, you don't have that. External validity is the ability to generalize your results to the population. There are issues with that. Talk about that. Paragraph 4, what are the real world implications? There are plenty of them. And how would you fix the limitations? How would you fix the problems in the study if you were doing future research? So these are 4 relatively easy paragraphs to put together. Make sure it's double spaced, 12-point font. Make sure discussion's on the top and it's centered and it's not italicized or not bolded. And then save it as a PDF and upload it to Blackboard. And I've provided the upload link here under discussion. And please upload it by the date that I provided here. And that's about it. So hopefully this helps you write the discussion. If you have any problems, let me know. Send me an email. And I'll be happy to clarify anything. And I'll see you back soon for the title, abstract, and reference section, which is coming up after the discussion section. So